What if the blood pressure reading your doctor waved off as normal is quietly wearing down your arteries year after year? And what if the number that sent them scrambling for a prescription pad was actually nothing to worry about for someone your age? I know that sounds backwards, but after more than 2 decades treating blood pressure in patients over 60, I can tell you the real danger isn't the number itself. It's that almost nobody, including plenty of physicians, knows how to read it correctly. Let's start with a statistic that deserves your full attention. According to the American Heart Association, close to half of all adults in this country live with high blood pressure. Once you cross 60, that share climbs past 70%. 7 out of every 10 people your age are carrying blood pressure that's classified as elevated or high. Here's the part almost nobody mentions. The Framingham Heart Study, one of the longest-running heart research projects ever conducted, discovered that your risk of heart attack and stroke doesn't switch on at some dramatic threshold. It creeps upward slowly and continuously, starting long before most people would call a number dangerous. So the real question isn't, is my blood pressure too high? The question that actually decides whether you end up hospitalized, disabled, or perfectly fine is, too high compared to what? Too high for whom? Too high under which circumstances? That's precisely what we're unpacking today. By the time this video ends, you'll understand your own blood pressure better than most patients ever get explained to them in an exam room. I'm Dr. James Myers, an internal medicine physician who has spent the better part of my career focused on exactly one population, adults over 60 and their blood pressure. I've sat with countless patients who left one appointment being told everything looked fine, then left another being handed a new prescription, patients overtreated and lightheaded, patients undertreated and drifting toward a stroke they never saw coming. None of that confusion is their fault. The guidelines have shifted more than once. Numbers doctors accepted as safe 2 decades ago are now flagged as dangerous. And the way most people check their pressure at home produces numbers that simply can't be trusted. Today, I'm untangling all of it. You'll learn exactly where the real danger zones sit after 60, based on the largest clinical trials on the subject, including the SPRINT trial, which rewrote the rulebook on treating blood pressure in older adults. I'll also show you a number almost no physician ever brings up, one you can work out in 5 seconds from any reading, and research shows it forecasts heart attack and stroke risk better than either number on its own. And I'll walk you through the everyday measurement errors that are handing millions of Americans false readings, readings that lead either to medication they don't need or to a false sense of safety that leaves real danger unnoticed. Quick note before we continue. This channel is just getting started, and we're working toward our very first 1,000 subscribers, so every single one of you counts. If today's video gives you something useful, tap subscribe. It costs nothing, takes 2 seconds, and it tells YouTube to put this information in front of more people who need it. And while we're on the subject, everything we're covering today, the real danger zones, that hidden third number, knowing when a spike is an emergency and when it isn't, these are the exact questions my patients bring to me every week. So I took what I walk my own patients through and built it into a single, simple plan for staying strong and healthy well past 60. 28 markers that shift as we age: blood pressure, blood sugar, memory, balance, and plenty more beyond that. Thousands of people are already using it to reclaim their health, and it's helping many of them feel like themselves again. You'll find the link on your screen right now at drjamesmyers.com, and I'll drop it again in the description so it's there whenever you want it. Now let's tackle something almost everyone gets wrong from the start. Every blood pressure reading gives you 2 numbers, and most people only ever pay attention to 1. That single habit has led to outcomes I've watched play out that never needed to happen. So let's break down what these numbers are actually telling you, because nothing else in this video will click until this part does. The top number is systolic pressure, the force your blood exerts on artery walls the instant your heart contracts. Picture a fist striking a drum skin with every single heartbeat. The bottom number is diastolic pressure, what's happening in your arteries during the pause between beats while your heart is refilling. Think of it as the baseline tension left in that drum skin even when nothing is striking it, the pressure your vessels sit under around the clock. Both numbers carry weight, but once you're past 60, they stop carrying it equally. And understanding why is one of the most useful things I can hand you today. As we age, arteries lose their natural give. They stiffen. And a stiff artery can't absorb the impact of each heartbeat the way a flexible one can. so that impact strikes harder. That's why the top number tends to climb with age, and it isn't always a disease process. Sometimes it's simply what stiffer plumbing does to pressure. Meanwhile, the bottom number frequently moves the opposite direction. Stiffer arteries don't spring back as efficiently between beats, so diastolic pressure often holds steady or even drops after 60. This produces a pattern that's extremely common in older adults, yet rarely gets explained. Isolated systolic hypertension, where the top number is high while the bottom sits normal or even low. It's the single most frequent form of high blood pressure among people over 60. Here's where things get genuinely risky. For decades, physicians were taught a shortcut. A normal systolic number equals 100 plus your age. Under that rule, a 70-year-old walking around at 170 was told that was fine. That rule was flat wrong and it cost lives. We now know, thanks to large-scale trials, that a sustained systolic reading of 170 in a 70-year-old substantially raises the odds of stroke, heart failure, kidney injury, and cognitive decline. That old formula reassured millions of people while damage accumulated quietly in the background, but the correction swung too far the other way. In 2017, the American College of Cardiology redefined high blood pressure as 130 over 80. Overnight, millions of people who'd been considered normal were reclassified as hypertensive, many of them over 60, many feeling completely healthy, many placed on medication they may never have needed. So where does the real danger line sit after 60? The most important answer comes from the SPRINT trial, published in the New England Journal of Medicine in 2015, involving more than 9,300 participants, the largest and most carefully designed blood pressure trial ever run. SPRINT found that pushing systolic pressure below 120 cut heart attacks, strokes, and cardiovascular deaths by 25% compared with the older target of under 140. Among adults over 75 specifically, the improvement was even more striking, a 33% drop in cardiovascular events. But, and this matters enormously, chasing that lower number aggressively brought real trade-offs: more fainting spells, more electrolyte disturbances, more kidney complications, more falls. And in older adults, a fall triggered by overly aggressive medication can be every bit as dangerous as the blood pressure it was meant to fix, which means there's no universal cutoff that applies to everyone. Your target depends on your age, your overall health, your risk profile, your history, your body. But I can hand you the ranges the research actually supports, and once I lay those out and reveal that hidden third number almost no doctor calculates, you'll wonder why this was never explained to you before. Here are the numbers, built from the SPRINT trial, American Heart Association guidance, and over 2 decades treating blood pressure in older patients. For adults between 60 and 75, systolic under 130 at rest is the ideal zone. 130 to 139 is acceptable if you feel well. 140 to 149 calls for closer monitoring and lifestyle adjustments. 150 or higher, consistently at rest. That's genuinely too high and needs action. For adults over 75, under 140 is the general target. 140 to 149 depends on how you're feeling and your fall risk. 150 or above consistently is too high no matter your age. Diastolic under 80 is ideal. 80 to 89 deserves watching. 90 or above sustained places real strain on your arteries and organs. Now, the hidden number I promised you, one you can figure out from any reading in 5 seconds, and research shows it predicts heart attack and stroke more accurately than either number alone, especially after 60. It's called pulse pressure, simply the gap between your top and bottom numbers. A reading of 150 over 70 gives you a pulse pressure of 80. A reading of 130 over 80 gives you 50. Why does that gap matter so much? Because pulse pressure is essentially a direct readout of arterial stiffness. Stiffer arteries drive the top number up while letting the bottom number drift down. And that widening gap is one of the clearest warning signs cardiologists look for in older adults. A major study published in the journal Hypertension, drawing on Framingham Heart Study data, found that pulse pressure predicted cardiovascular events more accurately than either systolic or diastolic pressure alone in adults over 60, stronger than either number by itself. Under 40 is normal. 40 to 60 is acceptable but worth watching. Above 60 is a warning sign of meaningful arterial stiffness and elevated cardiovascular risk. If your reading is 160 over 70, most people fixate on the 160, but your pulse pressure is 90, and that's a flashing signal that your arteries have lost critical flexibility and your heart is working under serious strain. Now, something almost no physician discusses with patients over 60, a danger just as real as pressure running too high, diastolic pressure running too low. In older adults, a diastolic number under 60 is genuinely concerning. Research published in the Journal of the American College of Cardiology found that adults over 60 with diastolic pressure consistently below 60 faced a meaningfully higher risk of heart attack because the pressure between heartbeats had dropped too low to adequately feed the heart muscle itself. I once treated a patient I'll call Harold, 74 years old, a retired mechanic from Tennessee, on 3 separate blood pressure medications. His systolic was well controlled at 128, but his diastolic had slipped to 52. He was dizzy every time he stood, and he'd already fallen twice in 1 month. Harold wasn't having strokes. He was over-medicated. His diastolic had been pushed so low that his heart wasn't getting adequate blood flow between beats. We carefully pulled back one medication. Within 3 weeks, his diastolic climbed to 68. The dizziness disappeared, the falls stopped, and his blood pressure stayed well controlled the entire time. His previous doctor had been so fixated on the top number that nobody noticed the bottom had dropped into dangerous territory. Don't watch only the top number. Don't watch only the bottom. Calculate the gap and make sure your diastolic never falls below 60. Too low can be every bit as dangerous as too high. I'd like to ask you directly, do you actually know your blood pressure right now? Not from some appointment months back. Right now? Have you ever worked out your pulse pressure? Drop it in the comments and let me know. I personally read every comment on this channel. Coming up, I'll walk you through the everyday measurement mistakes that are handing millions of Americans inaccurate readings that lead straight to the wrong treatment decisions, and I'll show you the correct way to measure, something almost nobody was ever actually taught. Before I show you the right way, let's look at how most people get it wrong. These aren't small errors. They can inflate your reading by 10, 20, even 30 points, and that gap is the difference between walking out reassured and walking out with a prescription you never needed. Mistake 1, measuring without resting first. You arrive at the office, check in, walk down a hallway, sit down on the exam table, and within a minute, the nurse takes your reading. That number is almost certainly inflated. A study published in the journal Hypertension found readings taken without a full 5 minutes of rest ran 10 to 15 points higher on the systolic number than readings taken after proper rest. Easily the gap between 138 and 148, between acceptable and too high. Mistake 2, talking while being measured. Research on blood pressure monitoring found that conversation during the reading raised systolic pressure by 10 to 15 points. The nurse asks how you're doing, you answer, and the number climbs without anyone connecting the dots. Mistake 3, crossing your legs. That same research found crossed legs added another 5 to 8 points to systolic pressure. Stack that on top of no rest and talking, and you're looking at a reading 25 to 35 points above your actual pressure, enough to completely change your diagnosis based on a completely inaccurate number. Mistake 4, the wrong arm or the wrong cuff size. Blood pressure can genuinely differ between your two arms by 5 to 10 points, so always measuring the same arm skews your picture. And a cuff that's too small for your arm inflates the reading artificially, something almost nobody ever double checks. Mistake 5, white coat hypertension, where blood pressure spikes in a medical setting because of anxiety you might not even consciously register. Your body reacts on its own, heart rate climbs, adrenaline releases, pressure jumps. A meta-analysis published in Hypertension found this affected 15 to 30% of people diagnosed with high blood pressure, meaning as many as 1 in 3 people currently being treated may not actually have a genuine blood pressure problem at all, just pressure that spikes only when someone in a white coat is holding the cuff. This is exactly why home measurement matters, and why doing it correctly matters just as much. Here's the exact protocol I give every patient over 60. Sit quietly for a full 5 minutes, feet flat on the floor, back supported, arm resting at heart level, empty bladder. No talking, no phone, no television. Take 2 readings 1 minute apart and record the lower one. Do this twice a day, once within 20 minutes of waking before coffee or breakfast, and once before bed. Switch arms every other day. Keep this up for 7 straight days, giving you 28 readings, then average them all. That average is your true resting blood pressure, not a single rushed office number, not a reading taken after sprinting across a parking lot, your real baseline. If that average sits consistently above 150 systolic or 90 diastolic, that's too high and needs attention. If it falls between 130 and 149, bring those 28 numbers to your doctor. They're worth far more than any single reading taken in an exam room. Now that you have the ranges, the hidden pulse pressure number, and the measurement protocol, there's one more essential topic before we wrap up. The question I hear most often from patients over 60. When does high blood pressure actually become an emergency? When should you call 911 versus simply monitoring at home? What warning signs turn a high number from something to watch into something that could kill you within hours? That's next, and understanding the difference could genuinely save your life. Here's something most people misunderstand about blood pressure emergencies. A high number on its own, even a very high one, is not automatically an emergency. I know that sounds counterintuitive, so let me explain. Say you check your pressure at home and see 170/95. Your instinct is to panic and head straight to the emergency room. Sometimes that instinct is exactly right, but often that number is a temporary spike from stress, pain, caffeine, or simply anxiety about seeing a high number. So how do you tell a spike from a genuine emergency? The answer is symptoms. A high number with no symptoms is a signal to monitor. A high number with symptoms is a signal to act immediately. Here's what turns a high reading into a true medical emergency. If your systolic is above 180 or your diastolic is above 120 and you're experiencing any of the following, call 911 without delay. A severe sudden headache unlike anything you've felt before, chest pain or tightness, new or worsening shortness of breath, changes in vision, blurring or partial loss, difficulty speaking or sudden confusion, or numbness and weakness on one side of your body. These signal a hypertensive crisis, blood pressure actively damaging your organs in real time, your brain, heart, kidneys, eyes. A study published in Circulation found that a hypertensive crisis carries up to a 25% mortality risk within the first year if it isn't treated promptly, 1 person in 4. But here's the flip side. If your reading is 170/95 and you feel completely fine, no headache, no chest pain, no vision changes, that's not an emergency, that's an urgency. And the distinction matters medically. Sit down, rest for 5 minutes, breathe slowly, and take the reading again. In most cases, the number drops 15 to 25 points within 10 minutes. If it stays elevated after resting, contact your doctor that same day or the next morning. I once treated a patient I'll call Margaret, 68 years old, a retired school secretary from Ohio. She called my office in a panic, her home monitor reading 182/98, already putting her shoes on to drive herself to the ER. I asked her 3 questions. Headache? No. Chest pain? No. Vision changes? No. I told her to sit down, feet up, eyes closed, and breathe slowly for 10 minutes, then take it again. She called back 12 minutes later. Her reading was now 148/84, still elevated, but no longer crisis range. That first reading had come right after a tense phone call with her sister, her body flooded with adrenaline in the moment. Her real blood pressure was never actually 182. Her reactive blood pressure was. Margaret didn't need an emergency room. She needed 10 quiet minutes and a few deep breaths. That's the essential lesson here. We don't treat single spikes, we treat patterns. 1 elevated reading is a data point. 2 weeks of elevated readings is a pattern. Know that difference, but also know when to act without hesitation. A reading above 180/120 paired with any of those symptoms means don't wait. Don't rest and recheck. Call 911. That's a genuine emergency and every minute counts. Understanding the difference between a spike and a crisis is one of the single most valuable things you can learn about blood pressure. Most people never learn it until they're already sitting in an ER being told they overreacted, or worse, being told they waited too long. Let's bring this all together. I want you leaving this video with clarity instead of confusion, with control instead of fear. Here's what you now understand that most people your age don't. Every blood pressure reading has 2 numbers. The top, systolic, is the force generated when your heart beats. The bottom, diastolic, is the pressure sitting in your vessels between beats. After 60, the top number carries more weight because arterial stiffness pushes it upward, but if the bottom number drops below 60, that's a warning sign most doctors overlook. And now you know to watch for it. You know the target ranges. For adults, 60 to 75, systolic under 130 at rest is ideal. 130 to 139 is acceptable. 140 to 149 needs monitoring. 150 or above consistently is too high. Over 75, under 140 is the goal. 150 or above consistently is too high regardless of age. Diastolic at 90 or above, sustained, is too high at any age. You know about pulse pressure, that hidden third number almost no doctor ever calculates. Simply your systolic minus your diastolic. Under 40 is normal. Above 60 signals meaningful arterial stiffness and elevated cardiovascular risk. And you can work it out in 5 seconds from any reading you take. You know blood pressure fluctuates throughout your day, rising with stress, movement, pain, and caffeine, falling with rest and calm breathing. A single high reading isn't a diagnosis. A consistent pattern is. We treat patterns, not spikes, and that one distinction alone can save you years of medication you may never have needed. You know the 5 measurement mistakes that can falsely inflate a reading by 25 to 35 points. Skipping rest beforehand, talking during measurement, crossing your legs, using the wrong arm or an ill-fitting cuff, and white coat hypertension, which affects as many as 1 in 3 people currently diagnosed. And you know the correct protocol: 5 minutes of quiet rest, feet flat, back supported, arm at heart level. 2 readings a minute apart, twice daily for 7 straight days, then averaging those 28 readings for your true baseline, worth more than any single number taken in an exam room. And you know the difference between a spike and an emergency. A high number without symptoms means rest, monitor, recheck. A number above 180 over 120 with a severe headache, chest pain, vision changes, or one-sided weakness means calling 911 immediately, a hypertensive crisis where every minute matters. In more than 20 years of practice, the biggest problem I see isn't pressure running too high. It's patients who don't understand their own numbers, patients frightened by readings they can't interpret, patients over-medicated because of a flawed office reading, patients under-medicated because their true pressure was never properly measured. Understanding your numbers doesn't create fear, it creates power. The power to ask the right questions, measure correctly, and know exactly when to act and when to simply breathe. So what's your blood pressure today? What's your pulse pressure? Take a real reading tonight using the protocol I just walked you through, calculate the gap, and share your numbers in the comments. I read every single one, and if you have questions, I'll answer them. If this video gave you real clarity, do 3 things for me. Subscribe right now. We're working toward our first 1,000 subscribers, and every one of you matters. Hit like, it tells YouTube to put this in front of more people who need it. And share this with one person over 60 who worries about their numbers. You might hand them the understanding that changes everything. And if you want everything I teach my own patients about protecting your heart and everything connected to it as the years go by, it's all in that same plan at drjamesmyers.com with the link waiting in the description. Blood pressure isn't a mystery and it isn't a life sentence. It's a signal, and now you know how to read it. I'm Dr. James Myers. Take care of your heart because everything else depends on it. This video is for educational purposes only and does not constitute medical advice. Consult your physician before making changes to your medications or health routine.